Welcome to your 2014 City of Knoxville Retiree Benefits Enrollment. During our time together, we will review our medical options, offer some reminders, and discuss enrollment information. Meet Christy Branscombe, our COO and Deputy Mayor. She is reaping the benefits of My Health and the Center, and so can you. Let's start by reviewing changes to your benefits for the upcoming year. Medical plan premiums will increase for all plans with the exception of $1,000 S. The utilization in all other plans warrants an increase. Additionally, as part of the Affordable Care Act, emergency room copays will count toward the out-of-pocket maximum for all $500 deductible plans. Beginning in 2014, the City of Knoxville will cover domestic partners. If you'd like to add your domestic partner, complete an affidavit as well as provide proof of the relationship through financial interdependence. For more information about the affidavit, proof, or the possible tax implications, please contact City Benefits at cityofknoxville.org. Now that we've discussed the changes to medical, let's dig a little deeper into our medical coverage. When you enroll for city medical coverage, you have three choices to make. You must choose your network, your deductible, and whether you want to participate in the My Health Wellness Rewards program or not. You have two network choices, S and P. They are both PPO networks. The benefits are the same for both the S and P network. The only differences are the providers in the plan. Network P includes 98% of Knoxville area physicians and all Knoxville area hospitals. Network S is only slightly smaller at 88% of Knoxville area physicians, the biggest difference being that Network S does not include Summit Medical Group. All area hospitals except Tenova are included. You are responsible for making sure the providers you see are in network. The only exception is if you see a doctor in the emergency room. For any follow-up visits, make sure they are in your network before you make an appointment. It's important to remember as you choose your network that Network P costs more than Network S. That's because Network P has more participating providers, and those providers have not agreed to discount their services as much as providers in Network S. But Network S also has many participating providers and hospitals. Many city employees and retirees are enrolled in Network P but are not using it, either because their doctor also participates in Network S or because they haven't seen any providers in 2013. If you are enrolled in Network P, now is a great time to check if your doctor participates in Network S. If not, would you be willing to change doctors? Now let's look at your deductible options. You can choose the $500 deductible option, in which case you'll pay more in premiums. Or you can choose the higher $1,000 deductible option and pay less. Let's compare. You can see that the $500 plan has a $500 per person or $1,000 per family deductible. The $1,000 plan has a $1,000 per person or $2,000 per family deductible. Both options have the same co-insurance and the same maximum out-of-pocket. So with any plan, once you meet your deductible, the plan will pay 80% and you will pay 20% until you meet your maximum out-of-pocket. And the most you'll pay out of your own pocket in 2014 is $2,000 per person or $4,000 per family, regardless of the option you choose, provided you stay in network. And notice, all plans cover preventive care at 100% with no deductibles or copays required. So if you're currently enrolled in one of the $500 deductible plans, should you switch to one of the $1,000 deductible plans? This is a really important question to ask yourself. And here are two more. Do you meet your deductible each year? If not, why are you paying higher contributions for a lower deductible? And second, do you have money in your RHRA? Some city employees and retirees have accumulated a lot of money in their HRAs. This is money that can be used to pay for expenses, including those toward a higher deductible, and you avoid the higher premiums. Which leads us to the last and probably most important choice in selecting your medical coverage: My Health or medical only. The My Health plan is medical and prescription drug coverage with built-in rewards for committing to a health-conscious lifestyle. The medical only plan is medical and prescription drug coverage without the built-in wellness rewards. Retirees who choose to participate in My Health and maintain all of the requirements pay less premium, sometimes significantly less, than retirees in the medical-only option. Why join My Health? Let's look at our peers. They've stopped smoking. They are eating better. And many are learning how to manage chronic conditions that might otherwise threaten their lives. The rewards are plenty: lower medical premiums, free or reduced prescription co-pays for certain medical conditions, for people who live with certain chronic conditions, free testing supplies, and HRA dollars from the city up to $768 a year. Remember, when you retired from the city, your HRA became an RHRA, but for the purposes of this presentation, we will refer to it as an HRA. So let's look at the HRA dollars more closely. By being an active participant in My Health, you can earn money in your HRA, $32 a month for retiree-only coverage, or $64 a month if you cover dependents. And if you or a covered dependent participates in the center's prenatal program, you can earn $200 in your HRA. You can use your HRA dollars to pay for qualified medical, prescription, dental, and vision expenses incurred by you and your eligible dependents. This includes out-of-pocket expenses that count toward your annual deductible, co-pays, co-insurance, and other eligible expenses. Not all expenses are eligible, though. You can visit wageworks.com for a complete list of eligible expenses. This web address is listed in your 2014 Guide to Your Retiree Benefits. If you don't spend all your HRA dollars during the year, they roll over to the next and are available to you as long as you remain covered by a city-sponsored medical plan. To qualify for My Health rewards, you must receive an annual health screening, be physically active and complete a monthly physical activity affidavit, complete quarterly health education, manage any chronic conditions you have, including tobacco use, and seek an annual well care visit for your covered children. The prenatal program is optional. Check out Mike, a great example of how My Health can be the start of a positive change. We're cool with that too, Mike. If you choose not to participate in My Health, but still want city-sponsored medical and prescription drug coverage, you can enroll in the medical-only option. Medical and prescription drug benefits are available for medical-only participants, but premiums for medical-only coverage are higher than My Health, and there are no built-in rewards such as HRA dollars and lower prescription drug copays. We've shown you the math before, but this is some pretty powerful stuff. Bear with us while we do it again. Say you want retiree-only coverage. You choose Network P, a $500 deductible, and medical only. You would pay close to $400 for coverage, or a little over $4,700 a year. Now say you just make one little change, from Network P to Network S. Everything else stays the same. Your monthly premium would drop to $337.29. Your annual cost for coverage would drop to roughly $4,000, saving you close to $700. Now say you make two changes. You not only switch networks, you also switch to the higher deductible. Your premium would drop even further to $262.18 per month. Your annual cost for coverage would drop to $3,138 $146.16, and you would save close to $1,600. Are you thinking about what you could do with $1,600? We thought so. So here's the grand finale. You make all three changes: the network, deductible, and enroll in My Health. You're now paying $243.66 a month. That's $2,933.92 a year, and you're saving over $1,800. And that doesn't even factor in all the rewards you get for participating in My Health, which would be an additional $384 a year. Let's do this one more time with Retiree plus family coverage. If your coverage is Retiree plus spouse or Retiree plus children, you can count on saving somewhere between the retiree-only example we just did and this example. So again, say you choose Network P, the $500 deductible, and medical only. You would pay $1,047.34 per month for coverage, or $12,568.08 a year. If you simply switch from Network P to Network S, your premium would drop to $894.09 a month, or $10,729.08 a year, and you would save over $1,800 a year just for switching networks. Now, let's add a higher deductible to the new network. Your monthly premium would drop even further to $695.01. Your annual cost would drop to a little over $8,300, and you would save over $4,200. Again, you increased your annual deductible by only $500, but you're saving nearly $4,200 in premiums. Finally, let's say you really want to save and get healthy in the process. You make the network and deductible change and sign the family up for My Health. You're now paying just under $650 a month, or $7,750 a year. You're now saving $4,800. And of course, that doesn't factor in all the rewards you get for participating in My Health, which would be an additional $768 a year. Wow. The bottom line is, deciding what plan is best for you and your family is a decision that needs to be made with a little thought and a little math. We are here to help. Just like Robin, we think there's more to it than financial gain. That's the obvious reason, but do it for your health. Your prescription drug coverage is part of your medical plan and is offered through Humana, so you have a separate ID card. Use your Humana ID card at the pharmacy. Take a look at the next slide to see the copays under our plan. Here are the copays for prescription drugs. Remember, if you choose My Health, you'll not only receive discounted prescription drug copays for medications used to treat chronic conditions, but you will also pay lower copays for non-preventive brand medications as well. It's important to know if requesting a brand name drug when a generic equivalent is available that you will pay the generic copay plus the cost difference between the brand and the generic drug. You can review drug lists at cityofknoxvilleRx.com for more information. Now let's turn our attention to the center. Most of you are already familiar with the city's Health, Education, and Wellness Center, also known as the Center. If you're enrolled in My Health, you've probably come to know the center pretty well. You don't have to be enrolled in My Health to use center services, only covered under one of our medical options. But My Health enrollees receive services for a lower copay. Every quarter, the center offers free health education classes on subjects like nutrition, exercise, diabetes management, and more. Although these classes are open to anyone, My Health participants can attend them to meet their quarterly education requirement. The center also provides free health coaching for employees with specific health concerns. The center staff will work closely with you to help you achieve your goals and empower you to take better care of yourself. The center also provides treatment for short-term illnesses for a small copay. You and your covered dependents ages 13 and older can take advantage of these services and pay with cash, check, a debit or credit card, or your WageWorks card. The center is run by Summit Medical Group, and all staff are bound by the same confidentiality requirements as any other healthcare provider. HIPAA privacy rules require that your health information be treated confidentially, and the center abides by those rules. That means that the city never sees your personal information. Your 2014 Guide to Your Retiree Benefits provides more information about the center, including the address and phone number. Now that we've reviewed the changes and given you a more in-depth look at our medical plans, it's time to enroll. You have until November 8th to make your 2014 benefit elections. Enrollment packets were sent to all retirees on October 22nd. Everyone must return the Medicare affidavit. The enrollment form and spouse surcharge form only need to be completed if you are making changes or adding a new spouse. If you do not complete an enrollment form, your current coverage will continue. However, please take a moment to include an email address for our records if you have one. This will help us communicate with you better. Everything we've talked about is here in your 2014 Guide to Your Retiree Benefits. And as always, the guide is available online at cityofknoxville.org/benefits. And if you have any questions along the way, Employee Benefits is here to help. Thank you for your time.